Welcome to our medical case scenarios, designed to educate on the diagnosis and key features of various vasculitis conditions. We'll present each case, followed by the most likely diagnosis and crucial next steps, or distinguishing characteristics. Scenario 1. Giant Cell Arteritis, also known as Temporal Arteritis. A 72-year-old woman presents with a 3-week history of new-onset headache. She reports jaw claudication while chewing and scalp tenderness when brushing her hair. She also reports fatigue and unintentional weight loss. Her ESR is 92 mm/HR. Fundoscopic exam shows pale optic disc swelling, most likely diagnosis, giant cell arteritis. Next best step, start high-dose prednisone immediately. This should be followed by a temporal artery biopsy for confirmation. Scenario 2. Takayasu arteritis. A 28-year-old Asian woman complains of fatigue, arm claudication, and dizziness, especially when raising her arms above her head. Blood pressure is 160/90 mm/Hg in the right arm and 110/70 mm/Hg in the left arm. There is a bruit over the left subclavian artery, and her ESR is elevated. Most likely diagnosis, Takayasu arteritis, often called pulseless disease. Key features include differential blood pressure between arms and large vessel vasculitis in a young woman. Scenario 3. Granulomatosis with polyangiitis, previously known as Wegener's. A 45-year-old man presents with recurrent sinusitis, epistaxis, and hemoptysis for 2 months. He has hematuria and red cell casts on urinalysis. Chest X-ray shows multiple cavitary nodules. His C anchor is positive. Most likely diagnosis, granulomatosis with polyangiitis, GPA. The classic triad involves upper respiratory, lower respiratory, and renal involvement. Scenario 4. Microscopic polyangiitis. A 55-year-old man develops rapidly progressive glomerulonephritis with hematuria. He also has proteinuria and rising creatinine. He has palpable purpura on his lower legs. He experiences mild hemoptysis, and his P anchor is positive. Importantly, there are no upper respiratory symptoms. Most likely diagnosis, microscopic polyangiitis, MPA. Key differentiator from GPA. No granulomas or upper airway involvement. MPA is strongly associated with pulmonary renal syndrome. Scenario 5. Eosinophilic granulomatosis with polyangiitis, or Churg-Strauss. A 38-year-old woman with a long history of asthma and allergic rhinitis. She now presents with worsening asthma, palpable purpura, and mononeuritis multiplex. This includes a wrist drop and eosinophilia at 15% on CBC. Her P anchor is positive in 40% of cases. Most likely diagnosis, eosinophilic granulomatosis with polyangiitis, EGPA. Key features are asthma, eosinophilia, vasculitis, and neuropathy. Bonus, quick scenario, Henoch-Schönlein purpura, a small vessel vasculitis. A 7-year-old boy develops palpable purpura on his buttocks and lower extremities. This occurred 2 weeks after an upper respiratory infection. He has abdominal pain and joint pain. Urinalysis shows mild hematuria. Diagnosis, Henoch-Schönlein purpura, also known as IgA vasculitis. Thank you for joining us in exploring these critical vasculitis case scenarios. We hope this session enhances your understanding and diagnostic skills. For more medical education, visit Sinoe Medical Association.